Talsik na. The news day continues here on One News Now. I'm Charles Lejano. The World Bank has approved a $500 million loan to the Philippines to support the government's vaccination and economic recovery programs. The World Bank says the additional funding is meant to strengthen the country's health systems and overcome the impact of the pandemic. Recall that in April of last year, the lender also approved a $100 million loan to the Philippines for its COVID-19 emergency response program. The World Bank likewise loaned the Philippines $500 million back in May 2020 to assist poor households and small enterprises weather the pandemic. The government is scrambling to implement measures to curb the recent surge in new COVID-19 cases. To talk to us about these planned measures, we have on the line Professor Guido David of the UP Octa Research Team. Good morning, Professor. Thank you for your time this morning. Let's talk about the NCR mayors implementing a uniform curfew. How do you think this will actually help bring down the surge in cases? Could you kindly explain this to us?
Yes, hi. Good morning, Charles. We think any measures that will limit mobility will definitely help slow down the pandemic. Actually, right now we're seeing a slowing down of the trend in some LGUs which implemented localized lockdowns. But the entire NCR is still on an increasing trend. The reproduction number is about 1.8 right now in Metro Manila. But having a uniform curfew is good because having curfews but them not being uniform will be confusing to people, to civilians. So this will actually help as long as, of course, they allow certain exemptions, such as drivers, so that they can go on, with their services and their business.
Right. I understand that this curfew is a temporary measure that we're implementing just to curb this current spike in cases. But then what other measures should the government implement right now under the current scenario?
Well, of course, it's a decision of the local governments, but they could look into scaling back some of the restrictions or basically implementing a stricter application of the GCQ. That means possibly reducing capacity in certain establishments, maybe even in offices. So these are some of the things that the local governments can do, aside from, of course, implementing more strict guidelines for wearing face masks and face shields and social distancing. So at least they can do the implementation more strictly so that we can make sure that people comply with these. And aside from that, the messaging, I think, has to be disseminated to the public that the virus is still here. And in fact, we're seeing evidence of the UK variant and the South African variants already in Metro Manila. And these are definitely a bigger threat compared to the previous variant. And we're not making this up. This is actually based on science, and they're more infectious. They're affecting more families. And that's why we need to slow down this pandemic in Metro Manila.
Right, let's talk about these new variants that you mentioned. That being said, Professor, would you be amenable, for example, if you were the one in charge, to implement a hard lockdown to bring down these new cases?
Well, the hard lockdown is always on the table, I believe, for the local governments to look into. Hard lockdowns will really be, destructive to the economy, but they will get the results done as far as reducing the number of cases, or at least slowing down the trend. And we have seen that, in fact, last August when we implemented MECQ, it was able to slow down and flatten the curve. That being said, our hospital occupancy is now at around 49% in Metro Manila. So it's not yet at critical levels. Although cases are rising, I think the local governments are going to give this a push to do localized lockdowns and more of targeted implementations, targeted lockdowns, and see if it works. And if it doesn't work, maybe the harder lockdown is on the table.
Right. Of course, we're all hoping it doesn't come to that. But then let's talk about the current trend. If this continues, how many cases are we expecting in Metro Manila and nationwide by the end of the month?
Yes, Charles. We actually prepared a model before, or a simulation that looks at an increase due to variants. And we wrote this report last February 17. And in fact, we were tracking it, and the number of cases was following the projections made in February 17. We assumed a reproduction number of 1.6. But right now, the trend has actually increased. The reproduction number has increased. So it's actually tracking more than the original projections that we had. So now it's tracking at, we'll probably see 3,000 or maybe even 4,000 cases just in Metro Manila by end of the month. So this is definitely tracking faster than our original projections. But we'll still go with the original 3,000 cases per day projections and possibly 5,000 to 6,000 in the whole Philippines. Make note that we've already had almost 4,000 cases in the Philippines yesterday. So that means it's actually tracking faster than our projections, because we said we would reach 4,000 by, I think end of the week or something. But it's already reached 4,000, more or less.
Yeah. So, Professor David, time will tell whether these policies will actually make a dent on the trend. But then let's talk about vaccines for a minute. We have some European nations who are suspending the rollout of AstraZeneca due to reported blood clots among recipients. Are these isolated enough incidents? And do you think the Philippines should follow suit, or at least be concerned?
Oh, well, Charles, that's definitely a very concerning news. But I think we still have to dissect these, studies and these reports, because sometimes there's no causality or no correlation between blood clots and the vaccine. That being said, what we're saying is that we don't know for sure. We can check with our population so far who has been vaccinated with AstraZeneca. I don't have access to that data, so if we had, we could check if there have been any reports or incidents of side effects. But of course, this is the decision of the Department of Health and the FDA if they're going to halt the vaccination. Right now, I don't have access to any more information other than those reports, and it would be good to see more evidence of these.
Right. As we await that evidence, we have other experts saying that the public shouldn't be too picky, really, as regards the vaccine brand that they will use, regardless of uncertainties over their effectiveness against the new variants. And some people are saying that the best vaccine is the one that you can get now, whatever it is. Do you agree with this?
Well, definitely, we should have the best. The best vaccine is what we have, because we don't really have many choices. It's a seller's market. I understand some of these European countries, they have more choices available to them because they have access to more vaccines. They even have access to Pfizer and Moderna. That's the nature of geopolitics. You could say it's not fair, but they have those advantages. So I agree that the best vaccine available is the best vaccine for us is what's available. That being said, we have to also make sure that these vaccines are safe and that's why I believe we have to investigate any types of reports. Again, I'm not saying one way or the other. It's just that we don't have enough information right now, and it would be good if we look at the data on vaccinations with AstraZeneca here in the Philippines, so that at least we can check if our vaccinations so far are producing any of these effects.
All right, thank you for your time and for your insight. That was Professor Guido David from the UP Octa Research Team. Granular lockdowns continue in 3 barangays in the city of Manila. But some residents are still confused about the lockdown protocols. To give us more details on the ground, we have Justine Punsalang. She's reporting live from Barangay 351 in Santa Cruz, Manila. Justine, could you give us the situation over there?
Charles, 3 barangays in the city of Manila is already on their 2nd day of the granular lockdown. So far, authorities have apprehended 9 violators during the course of the 2 days of lockdown. All of those apprehended are from Barangay 351, which is purely residential area. No apprehensions were recorded in the primarily commercial Barangay 725 and the 2 private hotels in Barangay 699, both in Malate. One of the lockdown violators was Madonna, a non-essential worker and breadwinner of her family who was on her way to work when she was apprehended. She said that before the lockdown was implemented, she asked the barangay for the requirements to be allowed to leave the area. She claims that she was told that all she needed was her company ID and quarantine pass. But authorities said she does not fall under the qualifications of authorized persons that are allowed outside of the residence. The police and barangay officials noted that they have been announcing these lockdown protocols since Tuesday afternoon. Those authorized to leave their homes include health workers, military personnel, service and utility workers, barangay officials, and media practitioners. Meanwhile, another violator was 75-year-old Lola Feli. She said that she was not aware of the lockdown guidelines and apologized for violating it. Both Madonna and Lola Feli, together with 7 others, were initially detained at the barangay's basketball court. They were transferred later on to the Tondo quarantine facility. This as Manila Mayor Isko Moreno announced that violators should be quarantined for 14 days after the lockdowns. But a quarantine facility personnel said the violators are still waiting to be tested for COVID-19. If the result is negative, they will be allowed to return home. But if the result is positive, the violators will be transferred again, this time at the city's COVID isolation facility. Aside from being quarantined, violators will also face city ordinance violation charges and will be required to pay a fine. Charles, authorities are hoping that after they showed how the Manila LGU is serious about the implementation of this 4-day lockdown, the residents will also take it seriously and not leave their homes for the time being. Police fear the possibility that the residents will grow bored as the lockdown continues and leave their houses, which would lead to their arrest. As of 2 p.m. yesterday, Charles, the city of Manila already has 1,206 active COVID-19 cases. Charles?
Thanks for that, Justine. That was Justine Punsalang reporting live from Manila.
In quarantine. 12 months of battling the coronavirus. 12 months of living in a new normal. This March 14, One News brings together the people who helped shape the way we live in the year of pandemic. How have we managed? What we may have missed? Where are we headed? Some of the country's leading voices in the scientific and business communities face the nation as the Philippines balances public health and economy. Kumusta na ba tayo? A town hall in the time of pandemic. Moderated by Robbie Alampay and Cheryl Cosim. Join us live March 14, Sunday. We are One News.
And those are the top stories of the hour. Join us later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.